Welcome to another episode of Science Matters. This is where we discuss science matters and emphasize that science really does matter. On today's episode, we are Africanizing mental health, and we are doing that with Professor Tholene Sodi from the University of Limpopo, who holds the NRF Research Chair in Mental Health and Society. Prof, welcome to today's episode, and how are you feeling today?
I'm feeling very well, and thank you very much.
Okay, just a nice overview introduction of who you are to our audience.
Thank you. My name is Professor Tholene Sodi. I am a professor of psychology and a research chair in mental health and society here at the University of Limpopo.
Okay. Prof, I prepared some few icebreaker questions for us before we dive into the mental health and Africanizing mental health.
Yes.
The first question that I have for you is mental health generational? Can I inherit it from my parents?
Yes and no. You do have what we call genetic predisposition, which means all of us are born into families with certain genetic makeups. We born with predisposition to certain conditions. For instance, there could be somebody who is predisposed to a physical illness like cancer or sugar diabetes, and so on. So the same for mental health. There are some conditions like your depression, your bipolar disorders, your schizophrenia, where a person may be born with that genetic predisposition. And so what really matters is the environment that you are exposed to, the social determinants out there, the trauma that we could be exposed to, poverty, economic hardships, and a whole lot of other factors in the external environment that may precipitate these internal vulnerabilities to lead to a situation where then you end up with a full-blown mental health problem. But otherwise, what we're saying is, on the one hand, you have this genetic predisposition, and then what happens out there in the external environment will determine, to a large extent, how and when you may end up having a mental health problem.
In our society, we have a lot of people that will come and say, I hear God, I hear my ancestors, I see, all those things.
Yes.
Then the question is mental health and spirituality related?
Very closely related in the sense that spirituality serves as a protective shield that fosters resilience. Mm-hmm. It's a shield that each one of us would have that would make us to sustain ourselves in relation to the world out there, in relation to others, in relation to the difficulties that we may be experiencing. So if somebody is spiritual, they basically have some kind of a protective shield, which would mean that they are better placed to can deal with challenges that they may be having. So that's why you find in moments when there are extreme stressors out in society, many people will tend to be spiritual. And in that sense, it is a way of trying to get a protective shield that will make them to be resilient and to can then be able to cope with whatever challenges that they are experiencing.
Okay. So the Science Matters is meant for the general public.
Yes.
People who are in the study and outside of the study.
Yes.
How would you define what mental health is to a layman?
Mental health is a state of psychological, emotional, and social well-being. And so that state of well-being is such that it may happen for a whole range of reasons that it may be disturbed. And if that happens, then you end up with a mental health problem, a mental illness. So that state of well-being can end up in a situation where a person has got a mental illness. And there are many types of mental illness that we have out there. Yes.
Remember yesterday when we had the discussion, you also told me about the beautiful, the healthy part of mental
Yes.
health as well. Do you want to elaborate more on that?
Yes, that's why we're saying mental health is a state of well-being. It's a state of being. So you are not, when we talk mental health, we're not necessarily talking about an illness.
Sure.
Just like when we talk about physical health, it's a state of well-being. But then you would have people who, because of a whole range of factors, may end up having that state of well-being being affected or interrupted to a point where then they may start to show or display some kind of condition, which could be a mental illness in our case. Yes.
One of the things that we make sure we do when we do this conversation is we humanize the researcher.
Yes.
Because people end up thinking that the researcher is a certain kind of person, is different
Yes.
from all of us. So take us through who is Prof. Sodi and what inspired this journey of mental health society.
Professor Sodi is someone who was born a few years ago in a place called Makuri, under the jurisdiction of Kgoshi Sekororo in the Tzaneen area, here in Limpopo province. So I grew up there, and I did my primary education and my secondary studies in that place, Sekororo. And then I came to the University of Limpopo. At that time, it was still called University of the North. And this is where I did my junior degree, a BA, majoring in psychology and sociology. And then I did my honors degree here as well.
Okay.
So I must say that from my context, that rural context in Tzaneen, I was one of the first 4 people from my village, actually, to come and study at the university. And so we were the first graduates, basically, from that area to have degrees.
Okay.
And so that in itself tells you the kind of environment and the kind of issues that gave rise to the kind of people we are. And so we grew up in that environment, and later on, of course, I then went on. As soon as I completed my honors degree here, I went to the University of the Witwatersrand Wits, and that's where I did my master's degree in clinical psychology, and I graduated from there. Then I worked in a public service Department of Health in the then Leboa homeland. That's way back. And then I stayed there for 2-3 years, but I felt this was not my kind of thing. The working in the public service was not really the kind of thing that I really enjoyed, because I felt deep down that I am a researcher. And so I then resigned. I went to University of Venda, and then I worked there for a while. After a few years, then I went to the University of Cape Town. That's where I did my PhD in psychology. And so then from the fact that I trained as a clinical psychologist, I practiced as a clinical psychologist, and then I have also been in an academic environment doing research in mental health. So I think collectively all those factors, and of course my background as well, growing up in that kind of environment and seeing the struggles of people and how they get affected by mental health conditions. I think all these things collectively got to a point where I felt it is important to really give attention to this field of mental health. And what really, should I say, drew me even more closer was when I started to research more about issues of mental health. And then I found that studies indicate that up to 30% of people would at some point in their lives experience a mental health challenge. 30%. That's a serious figure. Because if you talk about South Africa having, let's say, 50 million people, 30% of 50 million people, you can imagine what number that is. But then studies also indicate that at any given time, almost 20% of the population has got some mental health challenge. So again, that's a very shocking figure. And it essentially cuts across the board, whether we're talking about adults, whether we're talking about young people. And so with that realization, I then came to the conclusion that given my training, given my expertise, and having worked in that space for a long time and still being in that space, this is something that I can do, which I feel if I do to the best of my ability, I can make a difference in our people's lives. So I think those are the factors that really motivated me to a point where I felt I need to spend essentially all my research life focusing on mental health so that we can hopefully make the lives of our people much better.
I think this lends us very nicely to your research chair, mental health and society. We do believe that every research is solving a particular problem. And I've read you have a lot of publications. We've included some of your work in our June issue in the Science Matters.
Okay.
What problem is this chair looking at or trying to solve?
Yeah, well, mental health is very broad. Basically, just like saying physical health, it's too broad. So you need to scope your work, you need to cut out an area and say, this is what I'm going to focus on, because you can't solve all the problems that society has. So specifically, my research chair in mental health is focusing on 5 themes.
Okay.
Those themes are, firstly, looking at the social determinants of mental health. What is it that could be contributing to mental health, whether we're talking about positive mental health or, mental health problems. So the determinants of mental health, what are those? And we find there are so many of these. It could be your environment, climate change, for instance. It could be issues of poverty, violence, trauma, and a whole lot of factors that are at play to contribute towards influencing how people's mental health would be. So that's the one area of focus. The second area of focus is looking at methods of treatment, methods of prevention, and methods of rehabilitation that are out there. And again, looking at our context, African context, rural context in particular, given the location of our university. This treatment, prevention, and rehabilitation methods that are they relevant in the context of our environment? And from time to time, we find that some of these interventions are actually not that relevant or difficult to just simply transplant from the Western context into our context. So we're looking at those, essentially interrogating those interventions to see how we can then make them more applicable and relevant in our context. So we have invested a lot of time, energy, and resources in that space in the chair to try and make this relevant. The third theme is on issues of culture and mental health.
Okay.
And something very close to my heart, because we take a view that mental health is a social and cultural construct. When a person displays symptoms of mental illness, it is within a particular social and cultural context.
Yes.
And therefore, the things that could have led to their mental ill health are located within a social environment. And therefore, we need to understand what is the role of culture when it comes to issues of positive mental health and mental ill health. So that's the third one. The fourth focus area is mental health policy.
Okay.
Our government has tried to come up with a lot of mental health policies, pieces of legislation to address issues of mental health. But the reality on the ground is these policies and pieces of legislations are not adequately implemented for a whole range of reasons. And one of those being, of course, economic realities of our country. But generally, you find we have the Mental Health Care Act, for instance, that is out there, but more often you find it is not optimally implemented for the whole range of reasons. So we need to interrogate these pieces of legislations and policy guidelines that are there, so that we can see what exactly is it that make these things not to be effective in the way that they should be. So that's the fourth area of focus. The fifth area of focus of the chair is epidemiological assessment of mental health problems and some kind of risk surveillance. In other words, what we're trying to do here is, what is the nature and extent, or what is the prevalence of mental illness in, for instance, Limpopo province, in Mpumalanga province, in the whole country, in the home continent? Because we can only be able to address this problem if we know its prevalence. We have these figures, but we really need to do real serious studies that will go to the local area here, the local village, and go there and understand what is the nature and extent of this problem in that locality. That research is largely missing in our context in the country. And so we believe that this research chair will specifically address those. And we are mindful of the magnitude of this work. But we're not working alone. We are always trying to invite others through the chair, partnered with a whole lot of colleagues, both locally, nationally, and also internationally, to try and make sure that we put our resources together to be able to make an impact.
Okay. So as you're sharing, I was testing at least my mental memory.
Yes.
And from the 5 themes,
One,
I had
yes.
contributors to mental health.
Yeah, social determinants.
Social determinants.
Yes.
2, I had methods that we currently have.
Yes.
Are they properly applicable and are they relevant?
Yes.
The 3rd one was culture.
Culture.
The 4th one was policy.
Policy.
This one, I had epi, I had risk.
Epidemiological prevalence and behavioral risk assessment.
Yes.
Yeah.
So in these 5 things, these are the problems that we have. How is this chair methodology planning to find all these answers or research or study how each
One of these? Well, we would have many ways of addressing this. One way to address all these themes is to have students, masters and PhD students, honor students, located in the different themes. So that's one way of trying to get more results with fewer resources. So that's the one area. But the other way of doing it is to work collaboratively with other people, either here at the University of Limpopo, which is something that I do quite extensively, and also in other places, in other universities. So one project that is trying to address a number of these factors at the same time is what we call the Prepare Initiative, which is an acronym for promoting mental health in places of learning and development. This is an exciting joint project that is implemented by my research chair in mental health and society and a research chair also supported by the NRF, which is a research chair that is under the leadership of Professor Temane. And his chair is on schools as enabling environments. Now, what we decided to do was, looking at his strength, somebody who is in the places of learning and development in that environment, and with me being in the mental health space. So we came together and said, well, let's make an impact in places of learning and development. So that's how we then came up with this initiative, which intends to focus on universities, because universities are places of learning and development. It focuses on secondary schools. It focuses on primary schools. It focuses on early childhood development centers. It focuses on TVET colleges. It focuses on prisons, for instance, correctional facilities, because in those spaces you also have young people there, and there is learning taking place in those spaces. So through that initiative, we are trialing interventions, basically promotion of mental health. And through that, we're able to also do a bit of research on the determinants of mental health. We're also in a position to see whether these methods of treatment and prevention and rehabilitation are effective. Through that, we're also trying to interrogate the policy environment prevailing in those schools. Do we have adequate mental health policies that are in place in our schools, in our universities, in our TVET colleges? Because we need to have policies in order to be effective. So that is also embedded therein. And of course, because we are rolling out this initiative primarily in Limpopo and in Mpumalanga provinces, we are mindful of the cultural realities in these two provinces. Yes. So we are saying, as we roll out these interventions, are they relevant in our cultural context? And so that's where the culture and mental health comes in. And then, of course, as we do that, as we promote mental health in those spaces, we will also be able to pick up the prevalence. And we have already, from the research since we started in 2023, started to see a very disturbing picture about mental health conditions in secondary schools, because right now our major focus is on secondary schools. Okay. We have just been to a few schools in the last few weeks, in fact. Okay. And we quite disturbed about the kind of situation we saw there with the learners, the kind of problems that they came up with. I mean, we go there for research, but learners would break down as we're doing the research, and then we start to see we are basically scratching the surface. There's a lot of challenges in those spaces. And not only the learners, by the way, we also see this problem with the teachers, the educators.
Sure.
And then when you talk to the educators, some of them will tell you, look, I actually have a problem. And then you start to see that we really need to intensify these interventions that we are trying to come up with to make a difference. And we hope through that initiative we'll be able to make a difference. But as I say, largely we're looking at places of learning and development.
Okay. So this work has been happening for years now,
Yes.
and like I said, many publications have went out. So what are the key findings? And I'm saying this because I know there's a lot that has happened. What are the key findings that you would want our audience to take away today? And also maybe in the findings, are there other suggestions that you would share with us that maybe can also help us to implement them even practically on my own if possible? But if it's a policy level as well, it can also be shared.
Well, the key findings with the research we've done this far, I would say we do get a sense that indeed this problem is serious, the prevalence. And I think it does seem to lend support to the fact that mental health conditions are very prevalent in our society.
Yes.
So I think that is what we're beginning to see coming out with this. I mean, these are preliminary indications we see. We also see that the issue of stigma, it's a big problem. And people don't want to be openly talking about it because there is this misconception that when you talk about mental health, you're talking about people with, should we say, significant levels of ill health, like psychotic and severe depression. And mental health problems are not necessarily that. In fact, the very serious mental illnesses are just a small fraction of the many mental health problems that we have. Many people struggling with anxiety, with stress, trauma, and so on. And so these are the kind of things that we have in society. So stigma, we see that the prevalence is there. And of course, we also see the challenge in terms of these interventions and how they may not necessarily be appropriate for our environment. But again, as I say, we are still busy with this research, and we hope we'll be able to get even more findings. As you do indicate, we've got a few publications through this, and we've also produced quite a number of students. Since 2023, I think we've already produced about 26 students through that process. And of course, a number of early career researchers as well who have gone through our process. So far, we have more than 20 early career researchers since 2023.
This is a significant and wonderful achievement from your chair, Prof. So before we close, I also want to allow you to share any other thing that you want to take out there, but I'm also going to ask for someone who's like, oh, I would love to be part of this research group. I'm also into mental health, and any other thing that you would like to add in this episode before we close.
Well, we actually invite everyone, whether we're talking about students who are planning to do their postgraduate studies here at the University of Limpopo and elsewhere, that they can always hook up with us, and then we'll always be able to work collaboratively with them if they are outside our institution through their supervisors, to then be able to focus on some of the things that we are doing so that we can amplify the work that we do. We also would want to invite our colleagues, whether here or any other place, to get in touch with us so that we can then do this work and produce results that will have an impact. And we have, of course, started doing that, as I said earlier. We're working with colleagues nationally. We're working with colleagues both in the continent and across the globe on these issues. And so we are available, ready to work with everyone so that we can really advance the agenda of mental health in our country and in our continent.
Okay. I did not read any paper speaking about social media not sleeping. Do you think social media can also make me have mental health problems and not sleep?
Yes. In fact, incidentally, I must say, one of my master's students who registered this year is looking at social media and mental health. And from the preliminary investigations, the review of the literature, we're beginning to see, hey, there is a problem here. But, he's still going to be doing his study, and we believe that will also bring some very interesting findings. But yes, social media increasingly is becoming a phenomenon that has to be managed, because you see it with young people these days, instead of concentrating on conversations, even during dinner, and when they are walking, they are busy on this thing. And then you can see there is a problem there. And so we need to find means and ways of managing this, because you can't do away with it anyway.
Yeah, no, I can't wait to read the paper from your student, and I think it will fall probably in theme 1.
Yes.
Thank you so much, Prof, for being with us today. Any closing remarks?
Well, a closing remark, I would say, for me, is mental health. It's a reality out there. Mental illness is a reality out there, and there are many people who are suffering, struggling with mental health problems, and they're afraid to come out. And I would say, if you feel you are not particularly well in terms of your mental health, it is always a good idea to go and consult. Otherwise, if you wait much longer, the consequences may be too terrible. So I think we would encourage every one of us, if you feel you're not particularly okay, it's not a sign of weakness to consult. It is actually a sign of strength to seek help. Yes.
We just landed to the end of our episode with Professor Sodi. If you also want to share something, you're more than welcome to share in the comment section. Or maybe you have your research that you'd like us to read and share with the general public. Please do email us in our Science Matters email. Thank you so much for watching, and goodbye.